Okay, welcome again, everyone. Thank you so much for being here today. My name is Tina Swanek, and I'm the Career Explorer Northwest educator producer for KSPS PBS Public Television here in Spokane, Washington. Thank you for joining us today. We're very excited. Today we're going to be learning about careers in nursing with the help of Becca Bear from MultiCare in Spokane, Washington. And just a real quick introduction of Career Explorer Live. Career Explorer Live is an interactive Zoom event that connects young people with professionals so they can learn about careers and career paths like Becca's. Thank you so much, Becca, for being here today. Can you hear me all right?
I can.
Okay, wonderful. So real quick background about MultiCare that Becca works for, who Becca works for. MultiCare is the largest community-based, locally governed health system in the state of Washington. The company's comprehensive system of health includes more than 300 primary, urgent, pediatric, and specialty care locations across Washington, Idaho, Oregon, as well as 12 hospitals. And Becca is a registered nurse at the MultiCare Deaconess Freestanding Emergency Department in North Spokane. So once again, thank you so much, Becca, for being here today.
Yeah, thank you.
And we also have two schools joining us. I'll go ahead and put them up on the screen. We have West Valley High School, if you want to give a quick wave, along with Debbie Reeder, who is the career specialist for West Valley School District, and then also Lakeside High School, and Lakeside College and Career Specialist Nicole Perry. So Lakeside is on the right-hand side of our screen. So thank you all for joining us today. Before we get started, I wanted to quickly share the agenda for today's event. First, Becca will give us an overview of her education and career journeys, and then we'll open the floor for questions from our student guests from our schools. And we won't be taking any questions through chat today and instead engaging in this live discussion. So let's get started with our event. Becca, I'm going to have you
Hi.
go ahead and just give us kind of some quick background about your position and some of your daily duties there at MultiCare.
So I work in an emergency department, which is kind of a unique experience. So people come in and then their first usually interaction with the healthcare system when they start feeling ill or they get injured or something like that. And then sometimes I get to be the triage nurse, so I get to be the very first person and they get to explain what happened to them. They take their vitals, do a kind of a quick assessment on whether I think they're really, really sick or if they can kind of wait a little bit. That's kind of the triage nurse's job, is to decide if they need to see a doctor right away or if they can kind of wait and see them in a little bit. Um, and then the other thing that you do in the ER is that in the back, people will take care of usually about 4 patients. Um, and then I became an ER nurse about a year ago. I was a stay-at-home mom for about 7 years. I wanted to make a little more money because my husband was the only one working at the time. And so I started working as a CNA, so certified nursing assistant, at Deaconess downtown. I did that for about 5 years, while I kind of started taking prerequisite classes. I was a nurse tech, which is a position that Washington State has that's just for nursing students. So you have to be enrolled in a nursing program to be a nurse tech, and you get to do all the CNA responsibilities as well as like some additional responsibilities as you kind of are learning. And then I graduated from nursing school from Spokane Community College. Yeah, so that's a little bit about me. If you guys have questions, I'd love to take them.
That's great. Thank you so much. So we'll move into the Q&A portion of our session. This is the main reason why we do these events, is so that our schools have an opportunity to ask questions that really will help students to get the information they need to make good career decisions. So I'll go ahead and unmute our two schools, and we'll start with a question from Lakeside High School, and then we'll alternate between schools for the rest of the event. So Lakeside, what is your first question for Becca?
I will ask one. You mentioned that you graduated from SCC's nursing program. Was that the bachelor program? And if so, can you explain that to the students?
Yeah, so Spokane Community College actually has it's a 2-year degree in nursing, so it's actually an associate's degree. I know WSU has a bachelor's in nursing, and Eastern actually just started their nursing program, which is also a bachelor's program. Nursing's kind of an interesting field in that you can start as a CNA, get a 2-year degree in nursing, and then there's a lot of online programs to finish up your degree, or WSU actually also has it's called an RN to BSN program. So you can kind of do it as you are financially able to do it, or as your life kind of allows, which is nice.
Okay, West Valley, what is your first question?
How do you manage the emotional demands of your job, especially during tough situations?
Um, I manage the emotional tough parts of my job, primarily by taking a lot of deep breaths. That's always my first step. When someone gets angry, I tend to go quiet because usually when someone's angry, what they really want is to be heard. So I tend to get kind of quiet and let them say what they need and ask questions like, how can I help you right now? And stay in the moment. That's always kind of served me pretty well. As far as like emotional things, like when people are really sick and they're upset about it, like not in an angry way, but they're just really sad. That's kind of a similar approach, actually. Take a lot of deep breaths, let them talk, ask good questions. Don't give advice. Always good advice. Don't give advice. Because everyone experiences things really differently, and you don't want to project what you would experience that situation as. Like if I was in that situation, I would do this. Well, you aren't that person. They might respond really differently to that situation than you would, based on their life experience or who they are. So I think it's a lot of just like good listening is a big part of taking care of myself too, because if the situation goes well, it goes better for me too. And then as far as like taking care of yourself, it's really important to take your days off and actually take them off. I know a lot of nurses can get into a cycle of picking up extra shifts and like being at the hospital all the time. I really don't do that. I pick up shifts very rarely, if the department really needs it, or if I need extra money or something like that. But taking your days off and actually relaxing and doing things that take care of you is really important in a high stress job, for sure. Did that answer the question? Yeah, okay.
Okay, Lakeside High School.
What is a typical day like as a nurse that you look forward to in a day?
Typical day. So at least here, I'm going to speak to my department. I get here at 9 a.m. and some days it's already really busy and some days it's not as busy. So if it's not as busy, I usually try and we have a lot of trainings throughout the year. So if it's not very busy, I try and get some of those trainings done because they're all on the computer mostly. And if it is really busy, usually I will give someone a break. So like some nurse that's been there since 7 a.m., I'll take over their patients for them, and they get to go on break. But once I'm like in a section is what they call it, like once I have my 4 rooms in the ER, a lot of it is like walking people back from, they've already usually been triaged. I walk them back to their room. I kind of start asking them like what's going on with them. I kind of decide whether or not like they need to get in a gown or not. If they have like, if they're pretty sick, they probably need to get in a gown because we're probably going to do more testing. So I have them get into a gown. Like if it's usually pretty cold here, so I usually get them like a warm blanket because the gowns are pretty thin. I get them kind of hooked up to like the heart monitor if they need it, or get their vitals kind of going, and ask them questions, if they're there for abdominal pain or something like that, right? Have you been vomiting? Are you nauseous? Or do you just have abdominal pain? Sometimes people aren't nauseous and they haven't had diarrhea or constipation or anything. They just have a sharp pain in their belly. So, you want to like assess that, which could be like listening to their abdomen and seeing if they still have like your intestines will make noise when they are digesting things. So you kind of listen to the sounds on their belly. You can kind of like press on their belly and see if it's tender, that kind of thing. So I do my assessment, I get them hooked up to the machine, I get them all comfortable. Then usually like the doctor will go in and do his assessment or his or her assessment. And then they kind of write their orders. So their orders will be like things like, give them some pain medication or start an intravenous line and give them some fluids or pull these lab tubes out of their blood and then take them to the lab so they can run the tests. Or they're going to get this imaging. So they're going to get a CT scan. So it's a lot of like kind of assessing the situation and then doing a lot of tasks, particularly in the ER. My husband actually is also a nurse. He works on like on a medical floor at the hospital. His is much more like getting there in the morning and like going into a room, giving the person like their scheduled medications, assessing them, and then kind of throughout the day, providing them more and more care depending on their schedule of medications, their schedule of kind of like cares, which could be a lot of different things. Yeah. I don't know. Does that answer the question?
Thank you. West Valley.
Yeah.
What do you find most rewarding or challenging about being a nurse?
I would say the rewarding component for me has been like being with a person on one of the hardest days of their life and being able to be a comfort to them. So I know like the story that always sticks out in my mind is I had this was just after the pandemic, but I had this like older lady who was very, very sick. And she told me she just wanted to pass on because her husband was gone and her two boys were grown and they had grandchildren, but she felt like they were really settled. And she was like, I just feel I'm in pain all the time and I'm ill and I don't feel good and I just want to go. And I was able to like sit there and kind of have this conversation with her that like we talked and I think it made her feel better. And it was not a good day for her. And that's really rewarding to me because I know I always tell people like everyone is going to be a patient someday. Everyone gets sick. Everyone, if you're lucky enough, you get to be old. And then you're going to be uncomfortable probably. Everyone's going to be uncomfortable or sick or injured at some point in their lives. And I would hope that someone would sit and talk to me if I were feeling down and missing my husband and feeling lonely. And I think that's the component that has always felt really rewarding to me. You said challenging. Challenging is, I would say the social emotional component is both the rewarding part and the hard part. People sometimes when it's their worst day are not the most well behaved. So sometimes you get people who are pretty angry about what they think something should be going on and the doctor disagrees or the whole care team kind of disagrees about what should be going on, and that can get really tricky. People get pretty upset, but then you go back to like again taking a deep breath, trying to do some really good listening to like what do you really want out of what's going on, how can I help you right now, how can I make you more comfortable, that kind of thing.
Can you explain what triage is?
Yeah. It's triage. So it's like TRIAGE. So triage is like when you first come into the emergency department, you're going to meet up with a nurse and she's going to ask you, he or she, I should say, is going to ask you a bunch of questions. They're going to take like your vitals, which is like your blood pressure, get your heart rate, your temperature, see how your oxygen saturation. So like if you've ever been to I'll just show you. If you've ever been to like the doctor's office, they put that thing on your finger. This guy. Really cords. You put it on your finger, and then it kind of gives you like this nice blue waveform eventually. Ta-da. I swear, I'm alive. There it goes. Well, that's probably not that accurate. So right now it says my oxygen saturation is like 94% because it's a percentage. And that's basically like for every hemoglobin molecule you have in your blood, 97% of them have oxygen attached to them, which is good. You want it to be above 94%. But anyway, so they take your vitals. They ask you why you're there. They ask follow-up questions to that. And then they put in like your chief complaint is like what, your headline is, I guess, on the ER tracker. So, and then they'll write a note and they'll put your vitals in. And then there's a bunch of questions that we actually are required to ask you at triage. Some of them which are like, do you have any thoughts of hurting yourself or anybody else? Because we want to know that right away because we have a whole protocol for what we're going to do about that. Your allergies are really important. We don't want to like give you a medicine you're allergic to because then we have more than one problem we have to solve. And then essentially what we do is we give you a number. So and it's a ranking from 1 to 5. So 5 is like, you came into the ER and you're like, I'm out of this medication that I really, really need, and I can't get into my doctor, and I really need it though. So, but you're not sick really. You just need a refill on your medication. 4 is like, you have a cold and you maybe need like 1 or 2 things that we're going to do to help you. And then 3 can be a lot of things actually. But 3 is like, you're kind of a little bit more sick, but you're not super, super sick. You're a little sick. So you need some resources. Like you might need a medication or an IV and some fluids or something, but you're not like imminently, you're not gonna, they say like life and limb is the like phrase that we use. So it's like, you're not gonna die or you're not gonna lose like an arm, a leg, or an eyeball if you don't get treated right away. And then 2 is like a little bit, it's a little bit more sick than that. So 2 is like one of your vitals is like super off and we're really concerned about that. Like your heart is sometimes like maybe doing a weird rhythm and we need to like fix that right away. Otherwise you're going to get way sicker. Or you're going to get, lose an eyeball, a limb or something like that. And then 1 is like, if we don't do something right now, like this moment, you could die or lose an eyeball or a limb, something like that. Does that make sense? That way it like shows on the computer, like how sick you are. And then the doctor knows, oh, I got to go see that too fast because they're really sick. So I need to like go see them, assess them, and then put in the orders so the nurses can go start doing all of the things that are going to make them feel better.
That was actually a really great question. I've never thought
Yeah,
about
that was a good question.
definition of trauma. Yeah. West Valley, next question.
We want to know what strategies you use to help prioritize tasks during a busy shift.
Yeah, that's a really good question. That's actually something they talk about a ton during nursing school. So, because it's so important. So when you go to nursing school, you go to nursing school and then they have you take this big test called the NCLEX. And then if you pass, you get your nursing license. One of the big categories on the NCLEX is how to prioritize. And it's different than you would think. So I know one of the things they always say is that people don't die of pain. So it's very tempting during a shift if you have a patient who's like yelling about being in pain or like grimacing or very, uncomfortable, but you also have another person who's not breathing well. You always want to prioritize that person, the breathing, the patient who's having a hard time breathing, because you can die from breathing poorly, but you're not going to die from being in pain. So the way you really prioritize most tasks is through like the classic way to remember it is ABC. So if someone has an airway problem, which is like the connection from their mouth and nose to their lungs is either collapsing or it's swelling, or they're going to have a hard time getting air to their lungs. That's like number 1. We got to do that right now. The next one is breathing, which is actually, you'd think that was the same thing, but it's a little different, which is more of like, are their lungs actually functioning properly? Are they be able to expand their lungs and then like actually push out carbon dioxide properly so that they can like circulate it, which is C, circulation. So circulation is like, is their heart functioning really well enough so that they can circulate oxygen throughout their body, particularly to their brain, because your brain can only last 2 minutes without properly oxygenating before it starts to become what they call ischemia. So it starts dying essentially after like 2 minutes. So you have like very little time. So that's kind of the prioritization as far as like actually intervening. Other things like that are like you want to give pain medication before doing like what they would call case management stuff. So like calling a family member back or things like that. Those are really important. You want to make sure to always keep their family informed of what's going on, and so they don't have a worse emotional reaction than they need to. But them being in pain is more important than calling their family member back. Does that make sense?
Okay, great. Lakeside.
On days when there's like a lot of people in it that are like ones or twos, and there's not enough doctors, what do you do in that case?
Well, great question. Yeah, that is a really good question. Honestly, you do the best you can. Is probably the best answer. So you, that doesn't happen as much in this particular department, but we do have really, really busy days. So I would honestly, the big deal is like you want to deal with the most sick patient as much as possible first. That's always the priority. So if you have a 1 and a 2, you always go to the 1 first. If you don't have enough nurses, the other thing that's nice, I think, about the emergency department is that it's a team here. And I think that's true everywhere in healthcare for sure, but it is particularly true in the ER. If you have a patient that's they call it coding, which means like they don't have a pulse. So we're doing like all the CPR kind of dramatic stuff you see on like television and stuff. There's like a ton of people in this room. There's people starting IVs and doing chest compressions, and there's a respiratory therapist like usually bagging them so they're getting oxygen, and there's a doctor usually standing by like saying verbal orders, stuff like that. Yeah, so it's really a team effort. So if I can't possibly, like, this person's just really hard IV stick, I ask a friend for help. And maybe they're a little bit, they just happen to get it. So I think that's the two big things is you do the best you can, you prioritize the sickest patients, and you work as a team.
Could you share a memorable experience that shaped your nursing career? Like maybe something that you had happen that you knew you wanted to do it and keeping in the industry after it happened?
Sorry, say the last part of that question. A memorable experience that what?
Sorry about that. Just something that maybe that happened that you knew after that, like something happened, you helped someone or something, and then you wanted to stay helping people and stay being a nurse.
Like that made me want to stay being a nurse, like continue to be a nurse. So when I was in nursing school, I had a professor ask me like how it was to be because I was a CNA during COVID, and he was like asking me about my experience working in the hospital during the pandemic, and he was like, I said, well, I'm probably a little different than some people. A lot of people who were nurses during the pandemic retired early or they moved to different positions because it was a rough few years. And I felt like the experience actually made me want to go to nursing school more, primarily because I felt like as a CNA, there was a lot of things I could do, but as a nurse, you had a lot of responsibility, which is, stressful and challenging, but you had a lot of impact on patients. You're the person who's going to go in and assess and be like, this person is not doing well, and I'm going to call the doctor, and I'm going to honestly sometimes like strongman them into coming and checking this patient out, because sometimes, most doctors are great and they'll be like, oh, the nurse called, I'm going to go check him out. Some doctors are, everyone's a person, so there's always someone who's going to be stubborn, But it's your job as a nurse to be the person who's like, no, you need to come. This person is not doing well. And I need you to come and assess them and take care of them now. And that's kind of the interesting thing about nursing is that one of the phrases people will use is that nursing is the heart of healthcare. And that's because we do a lot of the calling families back and telling them how their patient is doing, the patient is doing. We do a lot of like coordinating the care. So like I work with the respiratory therapist directly. I work with the CNA directly. I work with the doctor directly. And those people don't necessarily work together. Sometimes they do, but as a nurse, you end up being the linchpin of the person's care. You make sure they get what they need, because you're the one monitoring them consistently over the course of their stay. Which is why I think during COVID, I realized as a CNA, like it's an important job. I love CNAs. They're great. They do awesome work. They make my job a lot better. But as the nurse, you are that person's person, which is challenging and hard, but also really, really rewarding.
Almost working as an advocate, really.
Oh, absolutely.
Okay, Lakeside, next question.
What made you want to be like an ER nurse specifically?
That's a great question too. So I like the ER because there is a ton of variety. So my husband works on a surgical floor, so he gets a lot of patients that are like, they just came back from surgery. They're going to help them feel better and send him home, which is great. And he's awesome at it. He's probably would do a way better job than I would at that job. ER is interesting because we get everything. So if you have I've had patients that have had asthma attacks. I've had patients who came in and they didn't have a pulse. I've had patients that, I had a patient recently that dislocated the two top bones of their finger, and like it was 45 degrees, and then they had a little cut here. Interesting, they call that orthopedic stuff, like broken legs, colds, flus, pancreatitis, which is weird, but it makes you vomit a lot. So you get the whole range of patients, which is really interesting for me. And it's kind of a bit of a puzzle. So every ER nurse I've ever met really likes puzzles because you get this random person and they just describe a bunch of things. And then you get to think like, I think what's going on is this. So you get to kind of put the pieces together and help the doctor kind of put the puzzle together, which I think is kind of fun.
What are some common misconceptions people have about being a nurse?
Oh, well, I think one of them is that we're all women. There's actually, particularly in the ER, there's a lot of male nurses. I think in the last like probably 10, 15 years, there's become a ton of male nurses. I think partially because a lot of men have gone into the military and become medics, and then they realize like, oh, I have like all of these skills that I could use after I leave the military, and they're really valuable skills. And they don't want to go to medical school because medical school is like a long, long process, and they were already adults. So one of them is just that men aren't nurses, and that's certainly not true. So there's some of the best nurses I know are men. I also have heard you're just the nurse a lot is something I've heard before, and I'm like, oh, contraire. Because if you want the doctor to do something, I'm the one you're gonna have to talk to most of the time. So, and depending on the department you work on, you sometimes have a little bit of flexibility to do things that, like I know, for example, in the hospital, if someone gets really, really sick on a surgical floor, they have what's called the rapid response team. So if someone was coming off of surgery, they were doing okay, and then all of a sudden they get really, really sick, those nurses have like 5 or 6 patients, so they don't have time to necessarily like take care of all their other patients and have this really, really sick patient. So they have a team that will come in and like help take care of that person. Well, the rapid response nurse has a lot of like, they're allowed to, you know, hang fluids without telling the doctor, because they're like, oh, well, their blood pressure is really low. They need some fluids. I'm gonna like hang some fluids because that's what they need. And I'm not gonna wait on this doctor to show up. So the whole idea that you're just a nurse is kind of another misconception, I think, because we have a lot of responsibility and also a lot of leeway to make you a lot more comfortable and make you feel a lot better.
Lakeside.
What is the ratio of paperwork you do for the patients versus like helping the patients like on?
You said paperwork?
Yeah, like what's the ratio of paperwork versus actually helping?
Oh, good question. I would say as far as actual paper, not a ton of paper, lots of typing, lots and lots of typing. I personally like they call it chart as you go. So there's a computer in basically every patient room throughout the hospital. And I like to, as I walk in, sign into the computer immediately, because then as I do stuff, I like to like do things and then put it on the computer that I did the thing. So that's hard to say. There's also like it's called the electronic medical record. There's a lot of like easy ways to chart things that don't take a lot of time. So I would say it's not very good at guessing. Depending on the day, 60-40, because you gotta the phrase my mom's a retired nurse, and the phrase my mom always used to say was, if it isn't charted, it didn't happen. So you always have to, if you like, for example, you have an older lady who wet the bed, you have to actually clean the old lady up, right? But then you have to chart it in the chart, because there's medical consequences if you don't change the lady's sheets and clothes and stuff, right? Her skin's gonna not do so well. And so you want to prove like, no, I changed all her sheets and I washed her up and she's just fine. And then I proved it by writing it in the medical record. But there's like easy ways to do that. So like there's like drop down menus and things like that. So it doesn't take as much time, I think, as it used to. It used to be all handwritten charts. That took a lot, I think, of time. Not as bad as it used to be, but you do have to chart a lot of things.
Okay, West Valley. I think we have probably time for maybe 2 more questions.
Companies pay for like additional schooling.
Yeah. So I personally paid out of pocket to go to nursing school, but my husband, when he was going to nursing school, he was a CNA, and the hospital paid for, I want to say, 80% of his nursing school. So there's a lot of opportunities. I know Multicare in particular has a program where even if you had gone to school and you have student loans, they will help pay back your student loans. And then if you're trying to go to school, they will help you do that as well. And I know that's pretty common. I know Providence also does that. And I'm not sure about other organizations, but large hospital groups, almost all of them that I've heard of, will help pay for additional schooling, for sure. You sometimes have to agree to work for them for a little bit or things like that, but there's definitely a lot of advancement opportunities as far as education.
Okay, Lakeside, last question.
I'll go ahead and ask one more. Are there any training opportunities or mentorships for high school students, or things they could be doing now while they're in high school to prepare?
That is a great question. High school might be hard. I know there's college, because you can volunteer at Multicare, like as a volunteer. They do like lab runs. So like after a nurse is like drawn a lab, they will take it to the lab for us, and things like that. But I think you might have to be 18. And then I know you can get a nursing assistant license also at the age of 18. And I know Multicare has a program for if you don't have any training at all, they will hire you as a CNA and then help train you to take the test to be a nursing assistant, and then you'll have a job afterwards.
Becca, is there anything else that you'd like to share with our guests about careers in nursing that maybe hasn't been covered in the Q&A portion of our event
Yeah.
today?
Nobody asked about money. I'm surprised.
Me too.
Because it's going to be important in your life. So I did a little research, and apparently, according to, I think it's salary.com is what I looked at, the average across the country was $68,000 a year. That's kind of skewed though, because I think Washington State nurses get paid more in general. I know the nursing position I looked at on the Multicare website, it was a range depending on education and experience. It was $83,000 to $120,000 a year. And nursing's kind of interesting because if you work nights, you're going to get paid more. And if you work evenings, so I technically, even though I show up at 9 a.m., is technically an evening shift because I work into the evening. I do 12-hour shifts, so I leave at about 9:30 at night. That's an evening, so I get a slight pay bump for that. You get paid more on weekends and holidays. You get paid a lot more. And the other thing about health nursing is that they, at least at this point in history, we are almost always looking for staff. So if you want to pick up extra shifts, you can always do that, pretty much. And once you hit 40 hours, you usually get time and a half, which if you're starting at, like let's say this particular nurse gets paid $50 an hour, time and a half is $75 an hour. So you get paid really good money. And that's not including if you happen to be picking up your extra shift on the weekend or at night or things like that. So there's always a lot of opportunities to make more money, which is great. And you're making money and helping people. So it's kind of a nice combination of things. I would say, it's really interesting. You talk to some people who have left nursing and they were like, I would never tell anybody to become a nurse. And I really don't agree with that. I know nursing is a very difficult career. It can be, but it's also so rewarding. I think that you really get to be there for people when they really, really need it. And I think sometimes too, like, if I were sick, I would have 4 or 5 family members that would show up, but not everybody has that. I've had patients who are in the hospital for sometimes a long, long time because they aren't physically able to go home by themselves. They can't take care of themselves, but they don't have any family. And you get to become their family for a while. And that's really important to them. They're really vulnerable populations, and it's really cool that you get to be there for people who don't have someone to be there for them. So I think it's a career of extremes. It's really hard. It can be really draining, but it also gets to be really rewarding. And I would say you have to really love people, because there are going to be days where you are going to think you don't like people because people get really challenging. But at the end of the day, they're sick, so they don't feel good. It makes sense that they're not behaving themselves properly. Yeah, I think it's a very rewarding career if you are willing to work hard.
Becca, thank you so much. And I can see why, not only why you love this career, but also why I assume your patients probably, I mean, they're not there under the best of circumstances, but they probably are very appreciative of the engagement with you because you're very compassionate and empathetic and kind. That comes across very clearly. So thank you so much for being here today and for taking time to share information about your career, your educational path, and some of the daily work that you do as a registered nurse.
Yeah, absolutely. Thank you.
And once more, I would like to thank our 2 schools who have joined us today. We have, again, West Valley High School and Lakeside High School. We really appreciate you guys being here. And thanks to Nicole from Lakeside for organizing this event for your school and to Debbie from West Valley.